Good day everyone. Today we will discuss the premature rupture of membrane or the PROM. Okay, first let's define the term. Premature rupture of membrane or the PROM refers to a spontaneous rupture of the amniotic membranes before the onset of labor. Gestational age usually determines the plan of intervention because if the gestational age is below 37 weeks, there is a specific treatment or intervention for that may differ to the patient having a gestational age of 37 weeks and above, which would be discussed later. If PROM or premature rupture of membrane occurs before 37 weeks of pregnancy, it is called preterm rupture of membranes or the PPROM. When the rupture of membranes is before term and birth will be delayed, infection becomes a risk, which is very dangerous for both fetus and the mother. Okay, here's the illustration or the picture of premature rupture of membrane. So as you can see, there is a leaking of amniotic fluid. Preterm rupture of membranes. It is the rupture of fetal membranes with loss of amniotic fluid during pregnancy before 37 weeks. So PPROM or preterm rupture of membranes or the preterm premature rupture of membranes is when the sac or amniotic membranes surrounding your baby breaks ruptures before 37 weeks of pregnancy. The cause of preterm rupture is unknown, but it is associated with infection of membranes or chorioamnionitis. So it accounts for 1/4 or to 1/3 of all preterm births. So it occurs in 5% to 10% pregnancies. So preterm labor may follow rupture of the membranes and end the pregnancy. So here's the definition of prolonged rupture of membranes. So it is when membrane rupture occurs more than 24 hours before the birth of the baby, which is not normal, which could be dangerous for both the baby or the fetus and the mother. Okay, first let's talk about the anatomy and physiology of especially the fetal membranes and the amniotic fluid and its function. Okay, fetal membranes, also known as amniochorionic membranes. Fetal membranes comprise of yolk sac, amnion, allantois, and chorion. They function in the embryo's protection, nutrition, respiration, and excretion. It cushions the embryo, protecting it against bump and against pressure of maternal organs, and it permits fetal movements, protects from injury, and provides lubrication for parturition. So fetal membranes is very important. Okay, here's the parts of fetal membranes. So there is a yolk sac, chorion, amnion. There is amniotic fluid there. Okay. Okay, let's talk about the amniotic fluid. So it is a clear, slightly yellowish liquid that surrounds the unborn baby or fetus during pregnancy. It is contained in the amniotic sac. The membranes are layers of tissue that hold the fluid. So it is the amniotic sac which hold the amniotic fluid. Okay, amniotic fluid is responsible for. So the first one is protecting the fetus. So protecting the fetus, the fluid cushions the baby from outside pressures, acting as a shock absorber. In temperature control, the fluid insulates the baby, keeping it warm and maintaining a regular temperature. Infection control. Infection control, the amniotic fluid contains antibodies which fight or control infection. And next one is the lung and digestive system development. By breathing and swallowing the amniotic fluid, the baby practices using the muscles of the systems as they grow. Muscle and bone development. As the baby floats inside the amniotic sac, it has the freedom to move about, giving muscles and bones the opportunity to develop properly. Next is lubrication. Lubrication, because the amniotic fluid prevents parts of the body such as fingers and toes from growing together, or webbing can occur if amniotic fluid levels are low. So it is very important that there is enough amniotic fluid for lubrication to prevent webbing. Next is umbilical cord support. So umbilical cord support, wherein fluid in the uterus prevents the umbilical cord from being compressed. This cord transport food and oxygen from the placenta to the growing fetus, so that there will be no what this blockage. So there is no obstruction. So the umbilical cord fairly there is a proper position of the umbilical cord, so that there is, in that way, the proper transport of oxygen and nutrients towards the baby will be in a good way. Okay, let's talk about the causes of premature rupture membranes. So in most cases, the cause of prom or the premature rupture of membrane is unknown, but there are possible causes or possible cause. So in rupture of the membranes near the end of pregnancy or term, those pregnancy who is in which 37 weeks and above, may be caused by a natural weakening of the membranes or from the force of contractions. While in the preterm or before term, premature rupture of membranes is often due to an infection in the uterus. Okay, let's talk about the risk factors. First is having a preterm birth in previous pregnancy, so that could be affect. And history of premature rupture membranes. Next is cigarette smoking during pregnancy. So it is also, according to research, it is also stated, or it has been, there is an evidence that uh, cigarette smoking is linked to premature rupture of membrane. So advised by the healthcare provider, or the who advise the healthcare practitioner to the mother or to the patient that the mother should stop smoking as soon as possible to avoid this kind of complication. Next is vaginal bleeding during pregnancy. Next is sexually transmitted infections. So that could be affect also. Okay, next, overdistension of the uterus in multiple pregnancy and hydramnios. Next is obstetrical procedures, application of cerclage and amniocentesis, because this application of cerclage and amniocentesis, it is an invasive procedure which could interrupt the normal function, or the normal function of the amniotic fluid or amniotic or the membranes, which could lead to premature rupture of membranes also. Next is having an infection in your reproductive system, and the abruptio placenta. Okay, I would also emphasize the low socioeconomic conditions. It is also a one of the risk factors of having premature rupture membrane, because as women or women in lower socioeconomic condition are less likely to receive proper prenatal care. So that's why it really affects it is one of the risk factor. Okay, let's talk about the clinical manifestations or the signs and symptoms of premature rupture membranes. So if you have this signs and symptoms, maybe the patient is experiencing premature rupture membrane. So as soon as possible, she should coordinate to the healthcare providers or doctor. Okay, first one is a sudden gush of fluid from your vagina. Next is leaking of fluid from your vagina. The third one, constant wetness in underwear. The fourth one is the passage of fluid is followed by signs of labor, cervical dilatation, uterine cramping, and pelvic pressure. Okay, that's the clinical manifestation of, or signs and symptoms if you have premature rupture of membrane. Okay, let's talk about the possible complications of having premature rupture of membranes. First is infection, such as endometritis, amnionitis, or chorioamnionitis. So chorioamnionitis, it is an infection of the placenta and the amniotic fluid. It happens more often when the amniotic sac is broken for a long time before birth. The major symptom is fever. Other symptoms include a fast heart rate, sore or painful uterus, and a bad smell from the amniotic fluid. Next is endometritis. It is also an inflammation and infection of the uterus. The amnionitis, an infection of the uterus, the amniotic sac or bag of water, and in some cases of the fetus. Next is cord compression that may cause fetal hypoxia. So increased pressure on the umbilical cord from the loss of amniotic fluid inhibiting the fetal nutrient supply. So fetal hypoxia, it is, or in intrauterine hypoxia occurs when fetus is deprived of an adequate supply of oxygen. It may be due to prolapse of, or occlusion of the umbilical cord, so which is very dangerous for the fetus. Next is cord prolapse, an extension of the cord out of the uterine cavity in the vagina, a condition that could also interfere with fetal circulation. So, cord prolapse is most apparent or present possible to occur when the fetal head is still too small to fit the cervix firmly. So, it is possible that the umbilical cord will pass through will pass to the vaginal opening, which could also, which is very dangerous for the fetus, because the the exchange or the transport of oxygen and nutrients to the fetus will be interrupted also. Next is separation of the placenta from the uterus or the placental abruption, so that could also affect. So another risk for to the fetus of remaining in a non-fluid filled environment is the development of Potter syndrome or distorted facial features and pulmonary hypoplasia from pressure. So, Potter syndrome is a fatal congenital disorder characterized by the changes in physical appearances of neonate due to oligohydramnios caused by renal agenesis and impairment. So, because there is not enough or no fluid due to leaking of amniotic fluid, because there is a rupture of membranes. So, this could also affect the growth of the fetus, which could affect him negatively. So next is the pulmonary hypoplasia. So pulmonary hypoplasia, it is a condition in which the lungs are abnormally small and do not have enough tissue and blood flow to allow the baby to breathe on his or her own. This can be a life-threatening condition. And also primary antepartum hemorrhage, because there is already an infection such as amnionitis or amnionitis, so it is very possible that it could affect, or the patient or the mother could have antepartum hemorrhage. Okay, here's the illustration or the big photo of the abruption placenta, or the premature separation of the placenta in the uterine lining. And the second one, it is a Potter syndrome, in which there is a, because due to leaking of amniotic fluid due to rupture of membranes, now there is no there is very less present amniotic fluid, which could affect the physical appearance of the baby. So there is a far eyes with skin folds, flat breasts, recent chin, low set ears, short limbs, contracture. So that's the effects, possible effects, which is the Potter syndrome due to lack of fluid, or due to lack of fluid, or very less amniotic fluid inside the membrane due to premature rupture membranes. So the third picture is the chorioamnionitis, or the infection of the placenta and the amniotic fluid. The fourth picture is it is the cord prolapse, which could affect the circulation, or which could interfere the fetal circulation, which could affect the transport of oxygen, blood, nutrients to the baby.